Thank you, Divyani. Let me try and get this up here. Bear with me. Okay, thank you once again. And good evening, everyone. Chief guest, His Excellency Simon de Cruz. Most of all, Dr Preeti Pandit for involving me in this event. It is an absolute honor to be invited to speak about Preeti and her work. I may not be able to talk very much about her book. I'm hoping to get a chance to read it at some point very soon, but I am very well acquainted with her work, and that's what I'll try to talk about a little bit today. I'm an interventional cardiologist like my dad, Dr VP Nair, who's sat over there, and I'm sure you all know my dad more than me. He's been giving speeches like this for a lot more years than I have. He'll be saying a few words shortly, so you'll get to listen to him in a short while too. Once again, we are cardiologists, we're medical doctors, and we work hand in hand with psychologists all the time. When I say all the time, that is not entirely true, because we try to do this, but it is often a misconception, okay, that medical doctors can treat things on their own and manage everything without needing the help of psychologists. In my practice, we have found that we need the help of psychologists for so many of our patients. Once again, I'm a cardiologist, and there's often this misconception that heart disease is just about treating the medical problem, and that once a structural abnormality is treated, then the work is done. We're like plumbers or electricians. If it is closed, we open it. If it is open and it should be closed, then we do the opposite. If there's a short circuit, we rewire it, and everything seems fairly simple. However, things aren't unfortunately so simple. Medical treatment or intervention often neglects the psychological aspect of things. Recovery and quality of life are often hampered when this aspect is not addressed adequately. The heart is a physical organ that I have the privilege to treat, like my dad. But we also attribute so much else to the heart: emotion, caring, empathy, and so much more. Preeti treats all these other aspects of the heart that I sometimes struggle to manage for my patients. I got to know Dr. Preeti Pandit a few years ago. Interestingly enough, she was introduced by my dad, who's known her for some years. And fortunately for me, she's taken such good care of so many of my patients, of our patients. The work of a medical doctor and a psychologist are very intertwined. The physical and mental aspects of so many diseases just cannot be separated. When someone finds out that he or she has a heart problem, there is often a flood of emotions. The stress of that knowledge alone is sometimes more dangerous than the disease itself. Very often the difficulty that we doctors face is in trying to get someone to accept that there is, first of all, a physical problem to start with. And only then can we start to treat the problem or reassure our patient that we also have very tangible solutions for them. Most patients are understandably in denial. We can sometimes manage this on our own with careful explanation by attending to the concerns of the patients and the family. However, we often do need the help from a true professional like a psychologist to manage this. Proper support is needed for both the patients and their loved ones. Physical recovery from a heart condition can sometimes be quick, but it can also be very prolonged. A cardiologist like myself can treat a heart attack almost immediately with angioplasty and often have a full medical recovery. But the psychological aspects can often take much longer to manage, as a heart attack is often a very traumatic experience for the patient and for the family as well. This can be more significant if recovery takes a longer time or even after open heart surgery. Thankfully, most of the time these days we can treat heart disease with minimally invasive procedures and techniques, but open heart surgery is there for the more serious cases too. And it is useful to know that about 30% of patients after cardiac surgery, heart attacks, or complex procedures actually experience clinical depression. There is no rule of thumb or magic formula that can tell you which patient will need significantly more psychological support. Experience tells you this more than anything else. Very often a few clinic sessions can make this very apparent. But sometimes it takes a year or two before we realize that patients are experiencing a lot more psychological trauma, if you will, that needs that special touch. And that's where Preeti comes in. She's helped so many of our patients over so many years. For me, more than a decade. I've been I think what you read was something off the internet. I think that was about 5 years ago. I've probably been in cardiology more than 20 now. So, and my dad more than 40. And we've been seeing all this for decades on end. We've had patients as young as 16 with palpitation and congenital heart disease and stuff like that need that special support, especially when you're so young. And even patients in their 90s, mid-90s even, with debilitating heart disease requiring psychological support. We even see tough army guys or rugby players in their 30s and their 40s. These guys, these ladies, these young gentlemen, some who are older, all need psychological support. And one of the things that have been very rarely recognized is how much of a role psychological support plays for all these diseases and for all these issues, and how much proper, adequate psychological support can make a difference in their lives. There therefore needs to be a holistic mind-body approach to treating heart disease and other medical conditions. And this is where, once again, a psychologist and a premier psychologist like Preeti comes in. I have personally seen the positive impact of Preeti's timely intervention on many of our patients and families. The overall recovery is accelerated exponentially when compared to those without adequate psychological support. Several patients who were previously extremely stressed about even stepping foot into a cardiology clinic are now cheerfully walking in and engaging in friendly banter with our staff during every single visit. So Preeti, thank you for taking care of so many patients and making such a big impact on their lives. I'm sure your book will just add to your legacy of helping people in need. Congratulations once again on this wonderful book. Once again, I have not had the chance to read it, but I endeavor to get a copy of it myself today. I will now make space for my dad, Dr. VP Nair, to say a few words, but before that, perhaps I would allow you to introduce him and to introduce my dad. But thank you once again. Thank you for the opportunity to speak. Thank you for the opportunity to share some of my experiences, and most of all, to share how you've helped with so many of our patients. Thank you.